Today I would like to go over the diabetes food spiral, and our logo is green for go, yellow for caution, red for stop, and a check that the lighter green is the best. All food spirals are healthy from top to bottom, left to right, light to dark, large to small. So the healthiest would be the vegetables. Vegetables can be canned, frozen, or raw. And if we choose to add a olive oil or canola oil, they would still be green, but it would increase the factor, and we will go over the factor in a few minutes. As you move from the green to the yellow, if you add a regular salad dressing, or if you add corn oil or a vegetable oil, it would be a yellow. And then as you move toward the center, this would be a red. It would be like a casserole. Like if you had green beans or broccoli or any vegetable, cream of chicken soup, cream of mushroom soup, French fried onion rings, cheese, eggs. So you have your saturated fat and it becomes a red. The lowest factors are on the green side, and then as you move toward the center, the factors increase. Fruits. Fresh fruit or frozen fruit without sugar would be a green. The yellow would be fruit juice, canned fruit, or dried fruit. The red fruits would be a fruit cake or pie or a pastry filled with fruit. Your breads and starches, whole wheats, whole grains, any of your vegetables like your whole kernel corn, baked sweet potato, oatmeal, all of those would be a green. Your yellow would be your white bread, white grits, white pasta. And then your red would be your cornbread, biscuits, or donuts. You need to make sure that on the cereal boxes, or if you're using bars or any of your breads, you need 2 or more grams of fiber per slice of bread or per serving. So you do not want to choose a cereal that says 0 grams of fiber or less than 1 gram of fiber. It needs to be a minimum of 2 for each portion. On your milk and dairy, your 1% would be a green, 2% would be a yellow, and then your whole milk or 3% would be a red. On your meats are chicken, fish, or shellfish, and 2 ounces would be 1 factor. And if it's a green, it needs to be broiled, boiled, baked, roasted, stewed, grilled, or stir-fried, not fried. On your yellow meats, this is going to be your lean beef or your white pork. And then your red meats would be fried chicken, fried fish, any of your luncheon meats, Pam, Vienna sausage, potted meats, all of those because of the higher fat. On your fats, canola oil or olive oil would be a green, and it's a monounsaturated fat. And then your polyunsaturated, like your mayo, or if you have your regular peanut butter, that would be a yellow. And your red is going to be your bacon, your cream cheese, or your sour cream. Now what I'd like to do is go over the factors. If you go to your doctor and they put you on a diabetic diet, it's basically, they're going to tell you it's going to be 1,500 calories or 1,800 calories. I can't count that high, so what we do is we drop the zeros. So if it's 1,500 calories, it would be 15 factors. If it's 1,800 calories, it would be 18 factors. So your vegetables are going to have 0 factors, and as you move toward the center, it's going to be a 1 and then a 2. And for your fruits, breads, milk and dairy, meats, and fats, it's going to be a 1 when it's green, a 2 when it's yellow, and then a 3 when it's a red.